After years of hard work, Cape Verde finally received a certificate from the World Health Organization declaring the country malaria-free. The country has over the years improved its malaria response program by strengthening surveillance and improving treatment and prevention across its different islands. The Atlantic archipelago of about 500,000 inhabitants becomes only the third African nation to have ever been declared malaria-free, after Mauritius in 1973 and Algeria in 2019. The World Health Organization Director General Tedros Ghebreyesus says Cape Verde finally becoming malaria-free is testament to the power of strategic public health planning, collaboration and sustained efforts to protect and promote healthcare.
And it gives me great pleasure to announce that on the advice of the WHO Technical Advisory Group on Malaria Elimination and Certification and the WHO Malaria Policy Advisory Group, I have certified Cape Verde as malaria-free.
WHO estimates that malaria killed 608,000 people worldwide and infected 250 million in 2022. Around 580,000 of those deaths were reported in Africa. In 2021, Africa accounted for 95% of global malaria-related deaths and 94% of infections. 80% of those who died from malaria in Africa were children under 5.
Keeping Cape Verde malaria-free will require ongoing training and continued investment in systems that protect the country against communicable diseases and continued vigilance. It will require continued investment in Cape Verde's strong primary health system, without which elimination of malaria would not have been possible.
Malaria is transmitted to humans through bites of infected female mosquitoes and is most prevalent in the tropics. Cases can be limited to flu-like headaches and fevers, or depending on the variety, can lead to death within 24 hours. Anti-malaria campaigns have largely focused on prevention through the use of mosquito nets and preventative medicines, as well as mosquito eradication campaigns using insecticides.
It's the people who make things happen. We lead and create the conditions. But if there is no citizen behavior and attitudes, if there is no citizen and community participation, the results will not appear. That's why we want to award this certification to the people of Cape Verde with a sense of responsibility.
Since the last peak in the late 1980s, malaria in Cape Verde has been confined to 2 islands, Santiago and Boa Vista, which have now both been malaria-free since 2017. Eliminating malaria became a national objective in 2007, leading to a strategic malaria plan from 2009 to 2013. WHO says the plan focused on expanded diagnosis, early and effective treatment, and reporting and investigation of all cases.
Conseguimos trazer aqui nível de segurança sanitária importante.
Public safety is important, of course, but health safety is also very important, and this certification can add value to tourism and to the quality of Cape Verde as a tourist destination.
Across the world, some 43 countries have been certified as malaria-free by the WHO after they had no local transmission of the disease for 3 consecutive years. Simon Gunia, CGTN.